Okay, so we are live. Hello sa mga nasa Zoom right now. It's 7:01. Doc Broly, later na lang tayo magpa-play ng intro video, no? Kasi 7:01 na doon.
Okay. Reminder lang to some people
Okay,
have asked
so I
me.
think we need to...
Some people kasi have asked me, Doc, we followed your advice na to extend anatomy to 3 days. Okay? And then ngayon, kumain siya ng 1 day ng pedya. Ngayon, hindi kami patapos sa pedya. So ano po yung gagawin namin? Shall we move on to OB for today? Or shall we parang isi-shift namin lahat ng mga subjects by 1 day? The answer to that is go na and shift to OB. Okay? Huwag yung i-shift yung mga subjects na parang nag-frame shift mutation kayo. Tutukan nyo na yung OB. Kasi yung pedya, mahahabol at mahahabol natin yan dahil once again, it's a day 3 subject in the med boards. You have 5 days before day 3 ng med boards. And you'll be given a bonus lecture also by Ian, aside from the pearls given by Ian De Vera. So in terms of the lectures, in terms of reinforcement, walang magiging problema pagdating sa pedya. Okay? And pedya is decahon. When I say decahon, it's really based on Nelson's plus the clinical practice guidelines. So more or less, you won't struggle so much with pediatrics. Kaya perfect na yung OB, kung extend yun ng 3 days, ang kinain niyang subject is pedya. Okay? For now, okay, OB na tayo for the next 2 days. So drop your, kung di pa tapos sa pedya, drop muna yung pedya. Okay? Mahabol at mahabol yan. And then tutukan yung OB. Okay? So yun lang muna. Mitch, let's go and do the Quizmasters.
Thank you so much, Doc Broly. Okay, handalin nating mga answer sheet. We will start now. So I'll be timing you for 30 seconds to 45 seconds. Depende po sa haba ng questions, no? Yan, so let's start. And that's the 10th question. So, ngayon, kailangan pa ba ng introduction ng ating quizmaster today? So, without further ado, let us all welcome Dr. Manuel S. Vidal. Doc?
Hello. Hi.
Morning.
Hi. Hi, good evening, good morning, everyone. Sorry. Share ko lang yung screen ko now. Can everyone see the slide po? Yeah, all right.
Yes, Doc.
Okay. Start with question number 1. Okay. So, what is the most appropriate counseling regarding the tetanus toxoid during pregnancy? Five seconds. All right. Cool. So most of you got it correct. No. So the correct answer for this item is sorry. The correct answer for that item is letter D. No. So here, Tdap, it's an inactivated vaccine. No? We recommend, we offer Tdap to pregnant women during pregnancy, regardless of the patient's history of receiving Tdap. No? So A is incorrect because, of course, whooping cough or pertussis, it's a vaccine preventable disease. No? So kung pwede naman natin bigyan ng bakuna, then as much as possible, i-avoid na, bigyan natin ng bakuna, no? And B is incorrect because it's an inactivated vaccine, no? It's not a live vaccine. And C is incorrect because we give Tdap usually between 27 to 36 weeks, age of gestation. So for the previous boards, palagi may 1 item or 2 items regarding schedule of your Tdap vaccination. So again, 27 to 36 weeks. And then yung primary niyan ay 2 doses, no? At 1 to 2 months in interval. And then yung third dose niyan, 6 to 12 months after. Tapos yung booster niyan, single dose once per pregnancy. Remember, once per pregnancy, nagbibigay tayo ng Tdap, no? So again, your Tdap, it's an inactivated vaccine. So pwede mo siyang ibigay. Live vaccines are usually contraindicated in pregnancy, so, such as your MMR, no? Varicella, and smallpox. We do not recommend giving typhoid and polio vaccine unless high exposure areas, no? And we do not recommend also giving HPV vaccine, although there's no consistent studies yet regarding HPV vaccination in pregnancy. Okay, so remember, kung may tatanda kayong vaccine in pregnancy, it's gonna be your Tdap. See, next, 29-year-old G1P0, 28 weeks, complaining of shortness of breath, no medical history, not on any medication, denies any chest pain, palagi daw siyang hinihingal, no? So on physical exam, normal naman yung pulse rate, blood pressure is normal. Cardiac examination, grade 1 systolic ejection murmur. Lungs are clear to auscultation. So which is the next step in management? Right. So very good. So I think aral na po sila, no? So most of you got it correct, no? So it's reassuring the patient. So this is a case of your physiologic dyspnea, no, in pregnancy. So remember that whenever pregnancy mommy, then there's an increase in your tidal volume, and then ibig sabihin nagkakaroon ka ng increased awareness of breathing. Tapos yung minute ventilation ninyo, nag-i-increase din siya. So pakiramdam mo meron kang feeling ng hyperventilation. No? So this may also contribute to your feeling of dyspnea. So mali yung A kasi wala naman siyang signs of pulmoembo, no? Ano ba yung signs natin of pulmoembo? Usually dyspnea, chest pain, cough, hemoptysis. So in many cases, there would also be evidence of deep vein thrombosis. So mali na kagad si A. B, again, ABG would be expected to be normal, no? So you do not perform arterial ABG. And C, again, normal na magkaroon ka ng systolic ejection murmur, no? In pregnancy, kasi meron kang increased blood flow, no, across your aortic and pulmonic valve. So kaya nagkakaroon ka ng low grade murmur. So again, na-emphasize ko to before sa unang Quizmaster, for your adaptations in pregnancy, it would be important to remember your respiratory changes, no? So simple lang yun. Tatandaan nyo lang kung sino lang yung nag-increase and yung nag-decrease, no? So yung IV ninyo, yung IC and your tidal volume, no, increases during pregnancy, and then yung expiratory reserve, no, and yung FRC and RV decreases in pregnancy. Okay, so again, the effects of physiologic dyspnea, it's because of progesterone. Kung meron kayong hormone na isususpect na nagkakause ng adaptations in pregnancy, it would always be mainly progesterone. No? Important din to remember yung cardiovascular changes in pregnancy. Okay, so cardiac output, usually natatanong yan, no? And what happens to your systemic vascular resistance during pregnancy, and especially your nadir. So it's the lowest point, no, at week 24 of gestation. Next, a 32-year-old woman presents your emergency department, abdominal pain, vaginal bleeding, amenorrheic yung patient, no, 8 weeks, and then yung PT niya is positive. BP is low, pulse is high, and on examination, her abdomen is distended and tender. So abdominal ultrasound shows free fluid, and then nag-exlap na yung OB, no? So which is the diagnosis for this case? Okay, so very good. Most of you, again, got the correct answer. So it's a ruptured ectopic pregnancy. Okay, so it's a ruptured ectopic pregnancy, no? So remember your molar pregnancy, which is going to be letter B, and your incomplete abortion, letter C, they would not be usually associated with free fluid, no, or blood. Blood yun sa abdominal cavity, no? Also important to note, meron ka ng sign of blood loss, meron ka ng hypotension, tas meron ka ng tachycardia, so most likely it's bleeding inside, and between B and C walang bleeding doon, no? Your torsed ovarian corpus luteum cyst, it presents usually with colicky pain, no, intermittent na pain that may radiate towards the groin, and usually kapag nag-ultrasound kayo doon, hindi siya magpe-present with free fluid in the abdomen, no? Makakita lang kayo ng ovary na walang Doppler flow, without Doppler flow. So ibig sabihin nun, walang blood na pumupunta sa ovary kasi nga in torsion siya, no? So nagsistop yung blood flow. So again, ectopic pregnancy, your diagnosis is the triad, no? It's pain, abdominal pain, vaginal bleeding, and amenorrhea. So classic yan. Pag sa boards, classic description palagi yung binibigay nila, no? And for ruptured ectopic here, for our case, you would expect hypotension and tachycardia. So management is immediate surgical exploration, no? Kasi meron ka ng hemodynamic instability. For most cases, we give methotrexate, no? So if you have contraindications to methotrexate, such as immunosuppression, then you would proceed with surgical options. Also remember yung difference between your salpingostomy and your salpingectomy, no? So yung isa, iniiwan yung fallopian tube, no? That's salpingostomy, and then yung isa, tinatanggal yung entire fallopian tube. That's salpingectomy. Next, 39-year-old G2P1, 39 weeks, nasa LND. BP niya is elevated, 150/100. Baseline niya is low, normal. Sorry, Patient reports no headache, visual changes, nausea, vomiting, or abdominal pain. Heart rate strip is reactive. Irregular uterine contractions. Cervix is dilated, 3 centimeters. Blood pressure, repeat, is elevated. Your platelets are 90,000. AST is normal, ALT is normal. So urinalysis is negative for protein. So this is a classic example of your preeclampsia with severe features. So that's letter B. So half of you got it correct, no? So remember that it doesn't really matter if you have proteinuria. No, I mean the previous diagnosis of preeclampsia, it depends on the dependence on proteinuria. No? So ngayon hindi na siya kailangan. So again, kapag meron kang elevated na blood pressure upon repeat, no? Tapos meron kang other severe features, no? That would already be preeclampsia with severe features. So, ano ba yung severe features natin dito? It's a repeat blood pressure of 160/90, no? And then your platelets are less than 100,000. Di ba? Again, may mnemonic tayo para sa severe features of your preeclampsia, no? It's bad triple. It's BP elevation, and then triple would be T is thrombocytopenia. R is renal insufficiency. I is intracranial disturbance. So that would be headaches or visual changes, proteinuria. L is liver function elevation. And finally, you have edema, pulmonary edema. Okay, so it's bad triple, no? So palagi lumalabas yung usually kung ano yung definition of your hypertensive disorder. So tandaan nyo lang din yan. And again, I've emphasized it before, your risk factors for preeclampsia. Okay? So next would be your doses, no, of concentrations of your Magsul, no. So remember 4.8 to 8.4, that's a buzzword, no. And then the first clinical test that you can do is your deep tendon reflex, no, to assess for toxicity. Last question for OB. So a 36-year-old G0, no, epileptic, gusto niya magbuntis, no. She wants to stop taking her phenytoin because she is concerned about the adverse effects, and she has not had any seizures for the past 5 years. Which of the following is the most appropriate statement for the patient? Okay, so medyo mixed bag this question, no? So the correct answer for this one is letter A. So about 30% of you got it correct. No? So babies born to epileptic mothers have an increased risk of structural abnormality. So regardless yan of anti-epileptic drug use, no? So meron silang 2 to 3 times increased risk of your congenital abnormalities because your seizures, they cause a transient reduction in your uterine blood flow, no? So kapag pag nagbibigay tayo ng anticonvulsant medications, lalong nag-i-increase yung risk for congenital malformations, no? So yung palagi nating suggestion for your epileptic mothers is that they wean off, no? They slowly taper down their dose of AEDs, no? If AEDs cannot be tapered down, then the goal is to have monotherapy as the pharmacologic regimen for seizures during pregnancy. So valproic acid, it's actually highly teratogenic. So it's associated with spina bifida. So it's a 1 to 2% increased risk. Vitamin C supplementation, actually this should be vitamin B9, no, folate supplementation. So it reduces the risk of your congenital abnormalities. And the most frequently reported congenital anomaly is not limb defect, but cardiac defects. So maybe 3 to 5 items, no, yung seizures in pregnancy. So please remember that estrogen would be the main hormone that causes your seizure, your effects in your seizure effects in pregnancy. And then also your best predictor would always be the amount of seizures the year prior to pregnancy. And remember that the most frequent congenital abnormality is your cleft lip and palate, followed by your cardiac abnormality. So lumabas to dati yung dalawang items na yan, no, in our exam. So valproic acid has the highest risk, no, and lamotrigine and levetiracetam, they have the lowest risk of malformations. Okay. Anti-seizure choice, medication of choice in pregnant patients would be Maxol. And hormone that is believed to cause increased frequency of seizures would be estrogen. Okay. So next, first question for gyne. So a 19-year-old patient presents to your office with primary amenorrhea. She has normal breast and pubic hair development, but the uterus and the vagina are absent. So which is the diagnosis for this case? Five seconds. All right. So most of you got it correct. Congratulations. So 68% of you got it right. No, so the correct answer for this item is letter B, no, Mullerian agenesis. So ang clue natin dito is that your patient has normal breast and pubic hair development. So ibig sabihin, meron kang estrogen function, di ba? Meron kang ovarian function kasi yung secondary sexual features ninyo would develop in response to ovarian function. So, ibig sabihin, mali na kagad si A, di ba? Kasi nagpo-function yung ovaries ng patient. C would now not be the case because it must be a male phenotype. Okay, Klinefelter syndrome, remember, it's a trisomy, no? It's XXY. So it must have a male phenotype. Letter D, Turner syndrome, they usually present with menstrual abnormalities, but for Turner syndrome patients, you do have a uterus, no? So the presence of your uterus, it rules out your Turner syndrome. So again, your kung may table kayong tatandaan for primary amenorrhea, it would be this one, no? Kasi nandiyan yung kung kailan absent and present yung breast, no? And kung kailan absent and present yung uterus, no? So your Mullerian agenesis, remember, it's also known as your MRKH. So they do have amenorrhea, but the absence of a vagina, no? So it's the treatment would be creation of a neovagina, no? So that's what we call your MAC endo procedure. So minsan nalilito din yung students, so with testicular feminization. So your testicular feminization naman, or your congenital androgen insensitivity syndrome, no, it's an X-linked recessive disorder, no. Yung phenotype niyan is XY. So hindi nagre-respond yung receptors niyo to testosterone. And so meron silang absent uterus and wala silang vagina, no. So for this case, no, for testicular feminization, usually we defer yung gonadodectomy kasi until you allow full development of your patient, full sexual feature development. In other patients kasi with the Y chromosome, usually we advise gonadectomy as early as possible in order to prevent masculinization. So next, which of the following pubertal events in girls is not estrogen dependent? Right. So most of you got it correct. No? So hair growth, it's not estrogen dependent. So 42% of you got it correct. No? So remember, your hair growth, it's caused by your androgens, no? From the adrenal glands, and later on from the ovaries. So the presence of your estrogen in a girl undergoing puberty, it leads to the development of your secondary sexual features, no? The development of breasts and production of cervical mucus and vaginal cornification. So as estrogen level increases, menses begin, no? So that's an estrogen effect. And then it may be responsible also for the termination of your pubertal growth spurt, di ba? Nagkakaroon tayo ng increase in accelerated growth, and estrogen yung usually nagsistop nun. And so that would determine your adult height. So it's an estrogen effect. So for your pubertal sequence, it's important to remember yung order nila, no? So my inconsistencies lang, no, with blueprints versus your gyne. So in blueprints, I think that accelerated growth comes before your menarche, no? Then menarche. But in compre-gyne, I think in compre-gyne, I think yung last nila ay maximal growth and menarche. But I'll get back to you for that. But remember lang na we always follow, well, for this case, for the past years, it's always blueprints. No? So if you would have doubts, please follow blueprints. No? So next, number 8, 51-year-old G3P3, 6-month history of amenorrhea. Hot flushes daw, awaken her at night. So interested siya with HRT, pero hesitant siya because of side effects, no? Healthy yung patient, no medical problems. Medication niya is calcium supplementation. She has a family history of osteoporosis. Average height 5'5", and then her weight is 115. You should tell her that HRT is associated with, okay, so very good. Most of you got the correct answer. It's associated with an increased risk of thromboembolic events. So that's letter C. So yung hot flushes ninyo, it's the first physical symptom of declining ovarian function. Diba? Kaya nagkakaroon ka ng symptoms even before menopause. And that's what we call your perimenopause. No? So vasomotor yung symptoms na yun, and then usually hot, feeling of heat, no? And then nagigising sila sa gabi kasi pinagpapawisan sila. The mainstay therapy would be estrogen, no? So estrogen therapy or hormonal replacement therapy, if you have a combination of progestin, it increases the user's risk of thromboembolic events, no? 2 times to 3 times, no? It does not increase the risk of uterine cancer or colon cancer or Alzheimer's disease. So your HRT, it even reduces the risk of colon cancer and Alzheimer's, no? May evidence tayo for that. And estrogen is also cardioprotective, no? It decreases total cholesterol and increases high-density lipoproteins and triglycerides. So remember your indications, your benefits, and palagi itong tinatanong contraindications to hormonal replacement therapy. Next, number 9, G3P3, 61-year-old, no? Complaints of AUB. Medical history is clean, started on estrogen and progestin, so it's a combination of hormones, no, for HRT. Non-smoker, moderately obese, and takes calcium supplements. The endometrium was thickened to 25 millimeters. Nag-biopsy kayo, no? And then which of the following would increase her risk for endometrial cancer? Okay, so the correct answer here is letter A, obesity. So remember that endometrial cancer, it's a disease of unopposed estrogen stimulation. So obviously letter B would not have anything to do with the case because it's calcium, no? Menopause at 49 years old, I think there's a risk factor that dapat ito ay 52. More than 52, increased risk for endometrial cancer kasi mas matagal yung exposure ninyo to circulating estrogens. The use of HRT does not increase your risk because she is maintained on a combined hormonal replacement therapy. May progestin kayong dinagdag. Remember, we add progestins to your hormonal replacement therapy for patients who have a uterus because we do not want them to develop endometrial cancer. So for endometrial cancer, here are the risk factors. So usually tinatanong yung increasing the risk. So if may tatandaan kayo, palagi lang kung ano yung nag-i-increase ng risk, no? Obesity would increase your risk of developing endometrial cancer because remember your peripheral fat, it's converted to estrogens, no? Tinanong din to dati, feature of type 1 and type 2 na endometrial cancer. And always remember, the initial management would always be EH, BSO, and PALS, no? So that's lumabas na rin yan before, okay? So that's what you need to remember for endometrial cancer. So last question, a 30-year-old woman presents to your office for her examination and contraception. Meron siyang previous deliveries without complications. May DVT siya after her last delivery, no? Significant for coronary artery disease, breast cancer for inside of the mom. She opts for a mini pill. So which of the following is true regarding the use of mini pills? 5 seconds. Very good. So most of you got it correct, no, it's 60%. So it's inhibition of ovulation. Your progestin only pills, no, your mini pill, yung usual complaint nila would be an acne flare. So it always increases your the correct answer for this one is letter D. Sorry. It worsens your acne. I'm sorry about that. The main complaint of patients for using POPs would be an acne flare, no? So it's not contraindicated in women with migraine. You only because progestins do not increase your risk for migraine or headaches. It's estrogen. You increase the risk of ovarian cysts with progestins, but usually mababa lang yung percentage nun, no? And inhibition of ovulation, it's not the main mechanism. The main mechanism would be to thicken your cervical mucus, no? So, palagi sila may 2 or 3 questions regarding contraceptions, no? And palaging pills yung tanong, either combined or progestin only, no? So your mini pills, they are ideal for women who are lactating and or do have contraindications to estrogen. And they do not inhibit ovulation, but they increase the thickness of your cervical mucus, no? Okay. So that's it for 10 questions for OBGYN.
Thank you so much, Doc. Doc, may nagka-clarify lang po for question number 4. Nalilito po kasi anong severe feature ang nasa patient? Bakit severe pre-ec yung answer?
Flash ko lang yung screen. Severe. Ha?
Wala, Doc. May
Sorry. So, wait lang. I-show ko lang yung screen ko. So, number 4, no? So, yung feature natin doon, see here, yung repeat niya na blood pressure measurement was 160/90. Repeat na yan, So, mataas na siya ng una, mataas pa rin siya ng pangalawa. And you do have thrombocytopenia. Remember, your cutoff for platelets would be less than 100,000. So those are the severe features. That's why it makes it preeclampsia with severe features.
Thank you so much, Doc. Doc, message daw sa kanila.
Ha?
Ano yung message mo sa kanila right now? Kasi Sige na.
Aral lang kayo guys. Important yung again important yung practice tests kasi doon kayo natitrain and as much as possible na pag mag-answer kayo ng tests, huwag kayong titingin sa notes niyo para alam niyo kung ano yung mga kailangan yung i-correct na concepts, no? And yan, palagi lang kayo mag-aral guys. Sorry, wala talaga yung social life for the next few weeks. So, ipunin nyo na lahat ng mga frustrations niyo, di kayo makalabas. Pero after 2 weeks, after a month, ma-earn nyo naman yung well-deserved vacation ninyo.
Thank you, Doc. Doc Broly, anything else po?
Okay, people have been messaging me on Facebook Messenger asking questions, nagpapa-explain ng certain concepts na nahihirapan sila. Okay, I reply within 24 hours, usually within 12. Okay, I usually set them mga 4 p.m., 5 p.m. Kino-compile ko na and then nagre-reply ako. However, napansin ko may mga hindi ako na-replyan na I think 2 or 3 tapos hindi ko na matrack. Ang dami kasing messages doon sa Facebook ko. So guys, mag-follow up lang. Doc, follow up lang po. Baka na-flood na po yung inbox niya. Follow up niyo lang sa akin. Okay? Pati yung mga fino-forward ko na doon sa mga teachers niyo. Pag hindi naka-reply after another, say, 12 or 24 hours from the time I told you na I forwarded them, just message me so I can follow up. Remember, ang dami. As in, ang dami. Probably I receive mga 50 messages a day from students asking for advice or clarifications or further explanations to concepts. Okay, so kino-coordinate ko naman yan. Ay OCD na ako dyan. Gusto ko nasasagot lahat ng mga tanong ng mga estudyante. So, just follow up. Just in case you're one or I think 3 people, hindi ko na matrace. I've been using search words, keywords sa hindi siya lumalabas. Pero alam ko dapat na-unhunt ko siya. So just follow up. Thank you so much, Mitch. Thank you so much, Mavi. Okay, your accent is developing very nicely there in the US.
Pauwi na ako, mawawala na ulit.
Wala na ulit yung Texan accent, Southern Texan accent. Maraming salamat. Okay, we end our Quizmasters here. Another Quizmaster within the next 2 days. Again, concentrate on doing OB for now. Okay, hindi OB talaga muna tayo. Okay, do a quick reading, second reading, do your practice test. Some people are asking me, Doc, kailan natin gagawin yung flashcards? Well, it's up to you. You can actually do them during your, halimbawa, habang kumakain, habang nagpupupo, habang naghihintay for rides. Okay, there's a 3-day difference between your final exams and the board exams. I'm looking at those 3 days na pagitan ng finals nyo and the actual main boards as the time that you can do yung mga hindi nyo pa nagawa, yung mga huling backlog sa halimbawa sa anatomy, okay? Yung flashcards ninyo, pwede nyo din doon tutukan. Practice test 4, pwede nyo din doon silipin. Okay? So medyo parang elective yung magiging 3 days na yon between finals and between the med boards. During your finals, okay, similar dun sa gagawin natin dun sa midterms, it's going to be from 7 a.m. to 1. We're going to, dahil na-anticipate natin, magka-crash uli yan, pagsabay-sabay kayong nag-take. So we're going to do, anticipating that, yung questionnaire, we're going to release it in advance na, around 7 a.m. for you to be able to print if you want that. And then, for the rest of the day, once you're finished by 1:30 or 2 p.m., take the day off. One final relaxation time for you. Go to a beach, go to a swimming pool, go do something else pagkatapos ng finals. Okay? Think of it as a final recharging before your actual med boards. Okay? So inaayos na, your final exam will be created by the major teachers in all of the 12 subjects. So halimbawa, ako gagawa ko ng 20 questions for Fisho. Si Dr. Borbe gagawa ng 20 questions for Micro. Ganun yung mga magiging assignments. And then, iba uli ang magdi-discuss ng mga questions sa inyo. Bakit iba yung magdi-discuss, Doc? Bakit hindi kayo yung gumawa ng questions ang magdi-discuss? Yung 2 tao na yon na magdi-discuss will serve as checker, okay, doon sa mga questions. So, those will probably be still Dr. Gabby Flores and Dr. Carl Avelo. Highly likely na sila. Kung hindi sila, gusto ko, it's either sina Tiff Oy or someone else to do that. So we're discussing, inaayos pa. Okay? But definitely, The questions will be varied, will be based on both the handouts and the previous board exam questions. So bawat teacher, okay, will contribute 20 questions for that. Yung mga major teachers niya in each of the 12 subjects. So good luck, God bless. Yun na muna, okay? Coordinate with your MG mentor kung merong mga mental health issues, kung merong mga study issues. You may also message me on Facebook, Enrico Paulo Bansuela. Wag Enrico Paulo Bansuela too. I don't use that anymore. Secondary account ko lang din siya. So if you have any suggestions, if you have any comments, bigay nyo na sa akin diretso yan para ma-improve natin yung system. Okay? I need that. Okay? Maraming nababago. Yung alimbawa, yung educational posters ninyo came out because someone suggested it midway. It wasn't in our original plan before the start of the program. Someone suggested, sir, pwede po ba magpagawa ng poster sa Top Notch kasi ganito, ganyan. So suggestions, comments, and feedback are very much welcome and I act on it. Hindi yan katulad sa med school na ini-ignore lang yung mga feedback na yan. So you need to direct it to me. Okay? Kailangan nalalaman ko. So sa akin, guys, okay? Sabihin nyo lang na maayos at naayos din naman natin lahat yan. Maraming salamat again, Dr. Chikay, Dr. Mavi. Thank you.
Thank you, Doc Broly. Ayan, so guys, thank you so much for attending our QM. Happy Aral today. For those na kailangan ng extra push, share ko lang yung video na to.
Thank you, Doc Mitch. Thank you po.
You're welcome po.
You can be the greatest, you can be the best, you can be the King Kong banging on your chest. You can beat the world, you can beat the war, you can talk to God, go banging on his door. You can throw your hands up, you can beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame. And the world's gonna know your name. You burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame.
You can go the distance, you can run the mile, you can walk straight through hell with a smile. You could be a hero, you could get the gold, breaking all the records you thought could never be broke.
Do it for your people, do it for your pride. How you ever gonna know if you never even tried? Do it for your country, do it for your name, cause there's gonna be a day when you're
standing in a Hall of Fame, and the world's gonna know your name, cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of
You can
Fame.
be a champion, you can be a champion, you can be a champion, you can be a
You'll be on the walls of the
champion.
Hall of Fame.
past failures may haunt you. You yourself may doubt you, but don't let none of it discourage you and stop you, block you from reaching your goals. Just believe in your own capability, ability to aim for the stars. You will overcome this war. You'll be licensed to heal and be licensed to help. This is for your mama and this is for your papa. Know that pain is temporary, but your license
Standing in a Hall of
forever.
Fame, and the world's gonna know your name, cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame. You could be the greatest, you could be the best, you could be the King Kong banging on his chest. You could beat the world, you could beat the war, you could talk to God, go banging on his door. You can throw your hands up, you could beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a Hall of Fame.
Thank you so much, everyone. Happy aral. Kaya yan.